Alright, so this is my SP encounter reflection. Things that I feel like I did well in the encounter. I feel like I did pretty good with communicating with the patient. I feel like my healthcare experience in the ER kind of has helped me with that. Going into the encounter to begin with, I felt pretty nervous. But once I get in the room and I'm thrown into that situation, I feel like my nerves just kind of level out and my intuition and experience just kind of takes over. So I felt like I feel like I did pretty good on that. Even the SPs, that was the thing that they commented on, was the fact that they felt like I did pretty good communicating with them and making them feel comfortable during the exam. Another thing that I feel like I did pretty good was foaming in and out, remembering to foam in and foam out. I feel like I was kind of cheating that I did good on that because the lady had told us in the beginning when she was walking us through that we could get bonus points, or quote unquote bonus points, if we remember to foam in and foam out. But again, my experience with the ER has taught me to do that, so I feel like that's pretty common nature to me. Areas where I can improve. I feel like there's a lot of room for improvement. One thing that I really noticed would be eye contact. I really struggle with eye contact, as you can tell in this video, because for me, looking away is my way of getting my concentration and remembering trying to put the words together that I need to say in order for them not to come out all jumbled. So eye contact is something that I'm really going to struggle with, but I need to work on it because I don't want, a patient to think that I'm not looking at them out of disrespect or anything like that. So that's one area I could work on. Another thing that I really noticed in the videos was trying to fill that awkward space. So there were situations in the evals where you could tell that I was trying to have some time to think and it got really quiet. And so for that, or at least in my opinion, for that patient, it gets kind of awkward during those times. So maybe trying to work on my multitasking where I'm thinking of the scenario and what could possibly be going on in the diagnosis, but at the same time, keeping the patient engaged in some kind of small talk so that I can, have that time but it not be awkward for them or me. Another thing that I've noticed in the videos is that I really was fidgeting with my hands. I noticed I would slap my knee a couple of times, and so to take that out, it's okay for me to talk with my hands, but when I'm not talking, trying to keep those hands at my side, under control. Another thing that I noticed that I didn't do, and it came back on a lot of the feedback, is I forgot to ask the patient if they were on any current medications. I did ask them about past, previous injuries and stuff, but I didn't ask them if they had any, medical conditions, if they had any surgeries, anything like that. So just trying to include that. Another thing that I noticed on those feedback forms that I missed was ensuring the patient is comfortable. For me, that's gonna be something that's hard for me to remember because I don't ever really remember doing that in the hospital either. So just ensuring that they're comfortable. Another thing during my eval process that I kept missing was when I would assess their pain. I would forget to ask them questions that could rule out neuro. So trying to include those questions so that I don't miss anything neurological that could be going on. And the last thing that I really feel like I can improve on would be being more prepared to answer any of those questions that they could have. In both case scenarios with the SP, I feel like those questions really threw me off, and I didn't have very good answers for them. And I feel like some of that maybe is just my lack of knowledge, to where I need to expand on my knowledge a little bit more. For instance, one of them asked me, well, what's an MRI, or what's a meniscus, or what is this testing for, or what is that? So just working and practicing on not only building my knowledge, but being able to interpret that knowledge into layman's terms for the athlete or the patient. Watching the video, when I first started watching the video, I was really nervous. And I nervous, anxious, it felt kind of weird. I kind of had a mixture of emotions as I was watching it. There was times where I would get a little embarrassed, especially when I decided to call the patient darling, which I don't even say that word in my normal life. There was also a little bit of frustration emotion going on, and just the things that I forgot to do, like the simple little things, like one of the evals, I'm pretty sure I missed doing passive range of motion, and so just those little things, and the neuro that I missed, and just being frustrated in the fact that I missed that stuff. What do I want to do better in future encounters? So again, kind of goes back to the answering questions, being more prepared to answer questions, and overall just being more natural, more myself, not feeling so stiff. And we've talked about in class how we get so caught up in trying to figure out what the diagnosis is, and so caught up in the eval that we forget that we're actually, there's a patient in the room. So, my thing that I would want to do better on is treating them like a patient, being more myself, being more natural, being better prepared for answering those questions, and also working on how I would deliver the diagnosis to them. That was another area that I felt like I could improve on, is being more general with my diagnosis and not being so straightforward, leaving myself room for error kind of thing, like we've talked about in class. Because in both of my encounters, I never gave them a differential. I just gave them one thing. So, being more general with my diagnosis and more natural are the things that I would want to do better in. My overall thoughts about the experience: I really liked this, the encounters. I feel like I benefited more from it than I did working on, CAR or McCall in class. Because, like I said, we get those questions that we don't know what to, that we don't expect. And whereas in class, we're getting to know them so much that we kind of are getting used to what they are going to ask. And so we're anticipating those questions and already knowing that. And I also felt like it felt more real. It was more practice with an actual person. Not that, I don't know how to explain it, but I felt like it was more beneficial for me to do the SP encounter than it was to do it in class. It was better practice on our communication skills and obviously our eval skills, but communication most importantly. I would definitely like to do these more frequently. It'd be awesome if we could do them as our tests every single time, practical wise, but I know that's a little hard to accomplish. But I really enjoyed the experience. I thought it was beneficial. The only thing that I would have to rate as a negative would be the cards that they were handing us, that the SPs were handing us. It got kind of confusing and you weren't really able to read them as you were going along. It would also be nice if the SPs would have had a little bit more time to prepare and practice. That way, you know, maybe their information that they had on the cards was matching up with what they were actually acting out. That way you wouldn't have to worry about reading the cards. But in my case, you know, after I got out of the room and was able to read those cards, there were things that I would have done differently in my eval. I would have added, you know, different special tests if I had known that information as I was going along. So, you know, just working out those little kinks with the SPs, I think would really make it even that much better. But overall, really liked it. Thought it was beneficial. My 3 goals to work on in eval and communication with patients. My number 1 is going to be being more natural in myself. You know, like I said in the beginning, going and treating the patient as a patient and not just getting stuck in let's figure out what's wrong with them and getting so stuck on that eval that I'm not even addressing the fact that that is a person. So doing that would be my first goal. My second goal, being able to answer questions better, being more prepared, more knowledgeable so that I can relay that information to the patient. And number 3, my goal would be to explain things to the patient rather than just doing things. So, you know, when I'm comparing bilaterally, tell them why you're doing this before you even start. That's one thing that I've noticed in my clinical setting is a lot of times my preceptor will just go and start working on a patient and not even tell them what they're doing. And watching those videos back with the SP, you know, they're curious. They're asking questions about what you're doing. And so maybe explaining, okay, we're going to do this. That way they understand before you even start. So those would be my 3 goals. Again, overall, really like the experience. Can't wait for the next one.